Thank you for the appropriations grant, $300,000 for our home health and hospice software program. We are just really excited about what it's going to do for healthcare, for the quality of care, the efficiency of care.
And lowering the cost.
And lowering the cost especially. It will enable us to communicate with each other, to be far more efficient in the delivery of the care that we're offering. And we really appreciate, and have two of our nurses, one from home health and one from hospice here, that want to tell you a little bit more about the specifics of how it will help us.
Well, as you know, I'm Darlene and I'm from hospice. And the way I think it's going to help us most is that we're going to be interfaced with the hospital. We're going to be able to give continuity of care, because when patients come into hospice and from a hospital, from home health or wherever, we're going to have their history, we're going to have all their information, and not have to, go searching and spend time to drag up those histories and that information. We'll be able to have it at our hands and be able to give more time for patients as opposed to doing paperwork.
I love that.
That is the best part.
But I had a background in electronic medical records before.
Oh, really? I didn't know that. Yeah.
And so I've absolutely loved electronic medical records from the very beginning. And all the studies that we were able to do to show the effectiveness of the cost effectiveness, and sometimes time is of the essence. And when you have that capability of being able to read someone's a medical history actually before they arrive, you can start the diagnostic process and also prepare, whether it be an operating room or to prepare the emergency room for the case that actually could be coming in. So that's going to save a ton of money. So tell me how it works from the standpoint. Give me kind of, for an example, you have someone at home and how you're some of the hardest things to do is the double entry, but thanks to DataLink, with the interfaces with all the hospitals, that DataLink processes are going to speed up the process, so you're not duplicating the procedures and double entries, which sometimes happens a lot.
And this will enable our home health and hospice to connect with DataLink, WNC Healthcare DataLink, that has not been possible in the past. So it will be the first non-acute care hospital that has that connection to the DataLink. So we're very excited about that. And Stephanie, you may want to mention how that will help from a patient perspective.
Well, I think from a patient perspective, it's going to allow us to spend a lot more time focusing on the patient and not spending time digging and trying to find out all the information that we need to provide that patient with the excellent care. We're really excited about this.
So you'll take a laptop?
Yes, we have a laptop, and we're able, out in the field, we have air cards. We're able to get online out in the field in our car, pull out information from Mission, St. Joe's, wherever the patient might be coming from, and see it all right there.